I'm Dr. Swathi I'm the ocular oncologist at LVPEI Eye Institute, and I specialize in doing the retinoblastoma work. So the common questions that we encounter when the parents present to us is, first is, how could have we detected this tumor earlier? So the answer is, whenever they see a white reflex in the eye of the child, or a cat's eye reflex, or a white glint that is seen in the eye, that is a symptom, or that's a sign that there could be retinoblastoma in that eye. That's the most common sign, which is present in about 60 to 70% of kids who have retinoblastoma. The second common symptom is the presence of strabismus, or the squinting of the eye. So this is present in about 20% of children. So the eyeball may be turned inwards or outwards. So whenever they see squinting, maybe it's not just the simple squinting. It could be that the eye is harboring the tumor inside. So whenever they see any of these symptoms, or even when they notice that they have a red eye or very painful eye, then they should immediately see their eye specialist, in specific ocular oncologist who would specialize in treatment of retinoblastoma. To get any treatment, first it is important to diagnose the disease, and the first step lies there, and parents play a very, very important role in this. So the most common age group that retinoblastoma occurs in is 3 months to 3 years of age. But of course, it can occur even much later, but this is the most common age group. So in any child, any of these symptoms are seen, then we have to rule out if retinoblastoma is present in that eye. So we have various treatment options that are available, and of course which depends upon the stage of disease that the child presents to us with. So if it is an early tumor, that is if the size of the tumor is smaller, if the tumor is localized, then we can treat the tumor by doing laser therapy, what we call as transpupillary thermotherapy, or we can do freezing treatment, what we call as cryotherapy. And if the tumor is large and it is still present inside the eye and there is no scope of saving vision in that eye, but it may harm the life of the child, in such cases the eye need to be removed. But if the tumor is large but still can be controlled and it is not threatening the life of the child, then we go ahead and give systemic chemotherapy. Systemic chemotherapy, of course, is not a one-time treatment. It should be given for a minimum of 6 cycles, and depending upon if the tumor is present outside the eye, then the systemic chemotherapy may have to be extended even up to 12 cycles. Even in advanced cases, then it has to be combined with radiation treatment, what we call as external beam radiotherapy, and sometimes the smaller tumors can be treated by local radiation, what we call as the plaque radiotherapy. So these are the various options of treatment for retinoblastoma. So the local treatments, of course, they do not cost much. They're usually less than 1,000 rupees. And for chemotherapy, systemic chemotherapy, each session of chemotherapy costs approximately about 5,000 to 6,000 rupees. And the other procedures like external beam radiation therapy, which we use very, very rarely, that may cost a little bit higher. At LVPEI Eye Institute, of course, we judge the financial status of the patient, and if they're not affordable, then we do the treatment completely free of cost. And here, when approximately about 50% of the cases every year receive treatment completely free.
Thank you.